Welcome. I am Dr. Laurel Barr. I am the chair of the Early Career Physicians section, and we're here with another section interview. We have Dr. Andrea Austin, who is the chair of the Women's Physician section, which is the American Academy of Women Emergency Physician, AAWEP for short. So, Dr. Austin, thank you so much for being here with me today. I'm very excited. You know I'm a member of your section, so we've got a lot to talk about here today. How did you get involved in the section? What is your role? Can you tell me a little bit about that?
Yeah, I would say my involvement is really personal. Starting in residency, I began to notice that women emergency physicians were treated differently. And it wasn't always good. Frequently, it wasn't great. And I began doing more research on, what's going on here. And I found that there, significant continued barriers for women physicians with the pay gap, with promotions. And so that really began my journey into women's groups. And I've been a member of various associations, but the reason AWEP is really important to me is the stressors that face women emergency physicians are different than women surgeons or women internal medicine. Not that any of our plights are easier, but there's specific issues that affect women emergency physicians. And so I felt it was really important to tap into that community, and I found a lot of support over the years.
Excellent. I have found so much support in the section, but I want to start with one of the things that I know is near and dear to you is that we are not an exclusive membership. So tell me a little bit about who is invited into the section and who can join.
Yeah, absolutely. So you don't have to be a woman to be a member of AWEP. We accept everyone. Everyone can be a part of our section. And I think now more than ever, we really need allies. So we value very much the men and again, people of all genders that want to be part of our section in solidarity and educate themselves more on how they can be effective advocates and understand some of the persistent issues. Sometimes I get asked, it's 2026. Do we still need a women's section? And I have gone on record many times saying I'd be happy to shut down AWEP if all discrepancies were gone. If we close the pay gap, if we have the same number of women chairs, women deans, women medical directors, once all of that, then maybe we can have that conversation. But what we know is in the post-COVID era, we've actually lost ground. We were doing better pre-COVID to what we're doing now. And so it is really important to continue to have spaces where people can share what they're experiencing and gain the support, the validation, and the resources to have the careers that they want to have. And with more than half of medical students being women, the only way we're going to have a successful workforce is if we keep everyone in the workforce. And so we know there's this bimodal drop off for women physicians. They leave this field early in their 30s to 40s. And the ones that stay then retire kind of on time, what's expected in their 60s. And we really need to figure out, well, we know what's going on. We need to figure out the solutions to keep women in emergency medicine in that crucial time in the 5 to 10 years post-residency, where many begin to feel that this field may not be compatible with the lives that they want to live. So that's why AWEP's here, and we're here to stay.
Yeah, I think you said it real well. And I've threatened many times to go from the early career physician section straight to the retirement section. And you just kind of explained the statistics behind my sentiments. But I want to go back to being kind of inclusive with everyone because it's having discussions, but these are not exclusive discussions. And I went to the reason I got involved in the section, I went to the section meeting and I found everything so fulfilling and like what something that I wanted to get involved with. And I told my husband to stay home from that section meeting because he was actually with me at the conference and went to some of the other sections. And I really wish I had told him to come to this one because I ended up taking some pictures of slides and sharing them with him. So it's conversations I think that we're willing to have that are applicable to everyone. So let's talk about what kind of conversations, what do we support, what is going on in the section, what can we expect if we join, if we go to the meetings, if we get involved.
Yeah, I love the way that you phrased it. And when I think back to our last scientific assembly, where we had our section meeting, one of the most popular sessions there was on being part of the sandwich generation. And our co-chair or chair-elect, Dr. DeAngelis, shared a very personal story about the plight of her parents, becoming sick, aging, navigating that while being a mom at the same time and a medical director. So she's in a leadership position, wears multiple leadership hats with her group, and just sharing, what that experience has been like and how she actually got through it. So I think it's important to have a space to share what's going on. And then it's also important to share solutions. And further to your point, our point is a well workplace for women is a well workplace for humans. And, we want men and people of all genders to be able to start families, to feel that they can spend time with their families, to have childcare, all in elder care. It's not just about people that have kids. I actually don't have children, but I navigated my father going on hospice. And while I was going through that process, I had a medical director at the time that was very not sympathetic and not helping with shift coverage during that time. So I think we all run into different things, and we want people to, I love what the whole physicians, a group of physician coaches say, we want people to be whole. You want you to be whole at work, and that you can bring your whole self. And, when you think about your career, let's say you get to practice medicine for 30 years. If you need 3 months off because of helping a family member, maternity leave, paternity leave, whatever it is, that is such a blip when you look over the span of 30 years. So I really hope that what our section can do is help people zoom out and see that larger career, and that we have to find ways to get over these blips, because they're not blips when you're going through them. They're life quakes. They're very disruptive. But from a workforce standpoint, we've got to get people through that so that they can continue to practice medicine, serve their communities, and honestly get to live the careers that they worked so hard and spent so much money to obtain.
And you mentioned so many things, kids, parents, different life stressors that when they are, they're life quakes. They take everything. And it's really hard to be present on shift for those, and having a supportive environment to work in that, maybe your medical director says, yes, take as much time off as you want, versus someone who says you can't come in tomorrow, makes the whole difference in the support and the system that you work in. And maybe if we go and work together and change these things over the long term, then we're going to get women physicians who don't take those life quakes and just quit, or who pivot, or who do something else, because it's real easy to do. And sometimes the path of least resistance is the easiest. And I've never seen anyone who's heard so much support from someone to say, take all the time you want, and then they take 3 years. We want to get back to it as much as we can. And that's not just women, that's everyone. But having that support and working with everyone, like you said, creates a better workplace for men and women, and just emergency physician in general. Burnout is a huge issue. So working on this together is really going to improve the specialty as a whole.
Yeah, I kind of now switched gears for a minute with that question. I do want to share a few other sessions that we've done in the past to give people more of a feel. One of the other sessions I really enjoyed last year was on the importance of strength training, because I think, again, what happens for women physicians is because we're taking care of everyone else, our patients, our colleagues, our families, we get put last. And that was such a good reminder that, this session hit home for me because I had broke my arm that summer, and I recently got a DEXA scan, and I'm actually osteopenic. And it was such a powerful reminder that I had been putting my health behind other people's. And that session, Nikki talked about lifting heavy weights and how important that is for our bones and our bodies. So I think, again, you're just getting content that you don't always get in other professional circles. And so we're really big on promoting taking care of yourself. So, you can be in it for the long haul, have a long career that at the end, you don't feel like a dish towel that's been wrung out, but you feel like this whole person that's had this amazing impact on your community and had a lot of friendships, and great relationships with colleagues along the way.
You said it. We got to advocate for ourselves. We have to think about these things in different ways, and maybe getting that wake-up call that we need to take care of ourselves. And AAWEP has several different offerings. I like to think about, expanding your network for some, just relaxing for maybe somewhere on the beach, and then also just an opportunity to connect with colleagues. Can you tell us a little bit more about the wonderful things that AAWEP is doing?
Yeah, so we've mentioned our section meeting at Scientific Assembly. And then another annual event is our retreats. The last couple of years, that's been an international format. We did our first one in Costa Rica, our last one in St. Lucia. We are still looking to see what 2027 will bring, so stay tuned. And then we have virtual offerings as well. So we have a book club, and you don't have to have read the entire book. You still get a lot from coming, even if maybe you're like me and you download it and only listen to a little bit. There's no grading at our book club, so just come and be part of the community. And then I'm really excited about an upcoming webinar that will be later this spring. We have 3 physician authors that will be sharing their journey to publication. So, I think a lot of us at some point maybe think, oh, could I write a book? What would that really look like? So myself and 2 other people, we have emergency physician that's been on the New York Times bestseller list that will be joining us. So it's going to be, and that's not me, that'll be a real treat. Yes, I'll say yes.
Dr. Austin does have a book available. I've read it. It's a powerful story about her journey in medicine, and I really related to it. So that's a good one as well. Sorry to promote your book as well, but that's awesome that there's authors coming up, because I just learned that how much you can charge for speakership fees, and I'm like, I chose the wrong career, so maybe I need to get that section or that webinar and start my next career in writing.
Well, that's the cool part, right? You never really know what's out there, and there's actually quite a network of women emergency physicians that have written books. So we want to just make that, making what seems aspirational, making it more in the attainable, and just now you'll have just a little more exposure. It doesn't mean you need to go out and do one tomorrow, but you have something else to add to your Rolodex. And that's the great thing about our careers, is we can be more than one thing. We can still work shifts in the emergency department and have this whole other outlets in life. So I think tapping into that career diversity, I'm a big fan despite the challenges, and that your 30s might be a time you're starting a family and you do want to drop down in shifts, consider staying part-time. and keeping part of your identity, not all of your identity, maybe as an emergency physician, but I think keeping your foot in the door and not giving up. And also knowing that I think what being part of AWEP let me know is when I was going through a hard season at a job, I shared some of that with Dr. DeAngelis, and she gave me some pretty frank talk that, there were some things happening that weren't okay. And she gave me some resources and actually connected me with a leader that I interviewed with. So I think, that's the other thing is we can all get into our silos and you only know your shop, your group of docs there, and being part of a national network, ACEP, AWEP, young physicians, whatever it is, provides that external resource that can help you keep this bigger picture that you're never stuck.
And to go on that, I was reminded recently of some kind of classic advice that if you want to be like someone, you surround yourself with people like that. And one of that was authors. And I'm like, wow, maybe I should go to a group of authors. So it kind of ties in. But the same
Yeah.
thing. When I was burnt out, I started talking to other people and they're like, man, how are you dealing with that? So getting out of that silo and another perspective sometimes helps and motivates change. So on
Yes.
that note,
Mm-hmm.
we need change. And AWEP has been working with some other sections on some advocacy priorities. And now we're gearing up for LAC, and then we'll have council where we
Mm-hmm.
write resolutions. What do you envision coming from the advocacy side of AWEP in the future?
So much work to be done. I'm very excited that there's a brand new section out there. There's the reproductive health section. Before they were an interest group, and now they've moved into having their own section. That is the section that we frequently, before when they were an interest group, now that they're a section, we will continue to collaborate with, as we see every year at council when resolutions come up related to access for reproductive health care, they're overwhelmingly supported. So we'll continue to be a voice of support for that section. Access, belonging, and community, ABC, is another section that we love to partner with. We've also had the international section reach out to us, and we're looking forward to doing some joint programming with them. And certainly when we have our international retreats, I'd love to see more of our international section members join in. I think that would be fantastic. And then young physicians, again, I think there's just so many opportunities for us to continue to collaborate and make sure the young physicians know that they can also have a second home with AWEP. And we really want to see our young physicians stay with the college and find their community.
Early career physicians, as we like to be called now.
Oh, yes. Sorry. Boy, I feel like the opposite of a young physician. Sorry. Early
So do
career
I. My back
physicians.
hurts. So I think this is a better
Uh,
time.
Early career physicians. Thank you.
Early career physicians, and the early career physician section has collaborated a lot with this group, the ABC group, advancing priorities that are helpful to us all.
Yes.
Um, what would you say the impact of being in this section has had on your career?
One of the things that being involved in a section does is it helps you start to understand the college more. And so a perk of being in the section leadership is every section has an ACEP board liaison. And so you were just on our AWEP leadership call earlier today, and Dr. Castelletto is our board liaison. And so a lot of times, we have an idea of something we want to do. And by having our board member at these meetings, she helps us see what's the actual process to make sustained change. and effective change. And you also get to work with an ACEP staff member. And I think that's a really powerful reminder that, I think I hear sometimes from people like, why am I paying dues to ACEP? Where does my money go? And I think when you're more involved with the college, you see how those dollars are used very responsibly, and that there is very much a return on investment. I was also on an email string going into leadership and advocacy about the different dine around events happening with lawmakers. And I think sometimes we forget that these events don't just happen. They take a lot of coordination behind the scenes, a lot of emails, a lot of calendar invites. And that is things that our ACEP staff do. And they really do make our lives better. And they go to work, 40 hours a week to work on behalf of us and to continue to make the working lives of emergency physicians better. So I think being involved with the section, you get to understand how the college works, and it's a great introductory. If you're thinking about another role in the college, other committee, or if you're thinking about even maybe I could be on the ACEP board someday, I think getting involved with chapters and sections is a fantastic way to start that journey.
And the great thing about sections is we control what we want to do. So they're the board members, the staff, they're here to help us. But if you've got something that you think needs done, then it's a really good way to get involved. And if you don't need to have the time to engage or do it yourself, you can sometimes email these section liaisons and then put it on their priority list and see what happens, because sometimes it just takes the idea and everybody's like, yeah, that's a great idea. Let's roll with that. And then you see kind of what happens. So from that standpoint, if we have early career physicians or any physicians in ACEP who want to get involved, what can we expect? How do we do that? And what kind of roles would there be for you?
Logging into the ACEP portal to your account, within there you can add sections, and it's not too hard to do. But if you are running into any problems, you can just shoot a email over to member services or call. You can call the ACEP number, and somebody literally picks up the phone. It's quite lovely. So if you're having any problems, just reach out to an ACEP staff member. So you just add the section to your membership. It's a pretty nominal fee. Don't quote me, but I think it's about $40 a year, right around there. So not a huge cost.
With the new physician bundle.
That's right. That's a very good point. And, I really do think that for that price point, you're getting a lot more value than $40 a year. And so you'll get our quarterly newsletter. You'll also be able to contribute to the newsletter if you like to write. There's definitely an outlet for you there. We have an engaged email listserv. So we have people that message on there sometimes if they have a project or research or something else that they want to share with the group. So it's a listserv of a few thousand people that you're able to tap into. And then we have webinars going on most months, and then our meeting at Scientific Assembly, and then another in-person event, retreat. And then we also hope to, in years to come, that we'll have some in-person leadership development events as well.
And I know we've had those before and hoping to continue those in possibly different formats going forward. Any advice for new members looking to join the section?
Get involved. The best way to get the most out of a section is pick something. And the committees that we have within our section are public relations. So if you're interested in writing for our newsletter, there's also social media. We really could use somebody that lights them up. We would love to have that energy. on that channel. Resolution writing. So maybe there's another world in which you would have been an attorney, or maybe someday you're going to run for Congress. Resolutions are a great way to scratch that itch because you're writing things that will be presented at ACEP Council, which I always say is like a mini version of Congress. And that's, how we make change in the college. So resolution writing is a fantastic way to get involved. And then awards. Awards always kind of makes you go like, what? Why would I get involved with that? But the truth is, we know that women physicians are not nominated for as many awards as men. And so this committee really has two folds. We have some internal AWEP awards, and you get to review people's award packages, which you might be going, snooze, boring. But it's actually really cool because you get to read about people's lives. What are they doing in their emergency departments? And then you get to select somebody to get an award, which is super cool. And then what it also helps you do is if you kind of see yourself as like, maybe someday it'd be cool if I got an award, or I'd really like somebody in my department to get an award, because we have community awards and academic awards. It helps you start to understand, what are the criteria? How does that process work? And that way, you can set yourself up, you can set your colleagues up. And I know sometimes people go, ooh, is that self-promotion? Well, yeah, it is. And that's okay. And especially women physicians need a little bit more of that. So any of those committees, we'd welcome you to message us. And certainly you can reach out to me as well. I'm on social media. My account is Andrea Austin, MD. You can find me on LinkedIn or Instagram and slide into my DMs, or we reach out to us through the AWEP section page.
I love your point about the awards, because if no one nominates women, then women aren't going to be chosen. And we don't self-promote ourselves as much as men do. We hide our accomplishments. We don't apply for anything until we feel we're fully qualified, whereas men will go ahead and shoot for the stars, and more often they get it because they try. So let's support ourselves. Nominate yourself, nominate your best friend, nominate someone that you think is doing amazing things, because they are. And we need to get more of that out there. And if we have the same number of women nominations, then we'll probably have the same number of women who get the awards. So let's do that.
I love that. That is such a great way to end on, because this job is challenging and we don't get enough recognition. And so I think outlets like AWEP are really important, that we can celebrate each other. And we need that right now.
Totally agree.
Absolutely.
Thank you so much for being here today. I really enjoy talking with you, working with you. Really a great section to be involved in, advancing, really trying to make the profession better, not just for women, but for everyone, with subjects that maybe we're more likely to talk about than outside of here. So thank you again for all that you do, and thank you for being with me here today.
It's been a pleasure. And thank you, Dr. Barr. I'm really inspired by all you're doing for ACEP and early career physicians.
Oh, thank you.